Nisambula, and welcome again to Hope Channel Fiji, and in particular, our series, Oral Health and Overall Health. And we are dealing with the TM joint right now, in particular, the characteristics and functions of the TMJ, as well as the TMJ disorders that is caused by negative attitude or attitude that is not very good. Okay, we welcome you today, and we also welcome our guest, Dr. Numaya Loanavanua, and we thank him for joining us today.
Thank you.
Doc, would you like to tell us a little about our topic there?
Okay,
TMJ?
can you just show the audience the TMJ?
Yeah, this one?
Okay, on the left and on the right, yeah?
Yeah.
It's right there in front of your ears, and it's your image, yeah? Mix up your face.
Okay.
And it's the TM joint, temporomandibular joint. It moves the whole body 100%, 24/7. And TM joint, temporomandibular joint, it moves all the 7 life stages. Baby, infant, toddler, child, teenagers, adults, and senior citizens. And it moves all ethnicities, all population groups. As long as you are a human being, TMJ moves you 100%, 24/7. And it does affect your oral health and overall health. And we can't sort of say, no, oral health that side and my emotional health this side. No, your emotional health, your physical health, and your spiritual health. It's not compartmentalized. They all in one wholeness. Okay. And so it's very important that we understand about the connection, the very intrinsic connection between oral health and your overall health. And we have come to a point, we know that right there in front of your ears is the temporomandibular joint, which moves every human activities.
Okay. All right, Doc, we're looking at the TMJ disorders. We're just continuing from our last episode where we looked at the characteristics and functions of the TMJ. And then we started on the disorders. Now let's have a look at the disorder that's there on our
and I think
PowerPoint slide there. And there are some things that are happening there, like stress, and those are some of the negative aspects. It's a negative attitude that will cause stress to the TMJ.
Right.
So we'll just have a look at that chart. We looked at it
when we
previously.
see that common health factor approach, the stress, it arrows to the heart disease, and then I think it got 2 arrows, and also to the periodontal disease. And you see, stress is normal, because good stress, right? Good stress, it gives you, just like a jump to do things.
Like for a student, you need stress in order for you to finish your assignment, to do your study.
But if the stress keeps on piling up and it's becoming chronic, then you're not, the stress is overtaking you.
Not managed properly.
Not managed properly, then it becomes. And then it does affect your heart and periodontal disease. And heart deals with blood flow.
Yeah, true.
Yeah. And periodontal disease, that's like your areas of the gums and the ligaments of the mouth. Yeah. And if people undergoes stress, unmanaged stress, and they eat any type of food.
Oh, yeah. Let's looking at
periodontal disease, oral health.
Like last week, I was having problems with my molar at the back.
Oh, okay.
And I went to my dentist, Dr. John, in the morning.
Oh, okay.
And I wanted him to extract the tooth. So he examined it and he told me, no, this is
gum.
Issue with the gum. There's nothing wrong with the teeth.
Oh.
Your tooth is good. It's just your gum.
Yeah.
And then he advised when you brush, you try and press. And then he also gave some antibiotics to help with the
help.
healing. Yeah.
And
So, we need to really take care of that. When we brush our teeth,
yes.
let's be careful. Use the proper toothbrush. Eh?
Yes, right. And the
Rather
time of
than the hard one.
toothbrushing,
Yeah,
eh?
the time. Yeah.
And
the
and
mothers.
the care. Yeah. Okay, is it something about mothers?
Yeah,
Yeah.
the mothers.
Mothers do the work. Yeah.
You tell our
Okay, again, we'll go back to that story when the Korean graphic artist, she asked me, what about the dental tooth decay rate in Fiji amongst children? Then I said, oh, it's high. It's 80.
Very, very high.
Yeah, it's 80+% in the 2004 survey. And I asked her, what about you in South Korea? And then she said, oh, not much amongst children. Eh? Then I asked her, okay, why? Why is that scenario so different from us here in Fiji? And she said like this, mothers do the work.
Mothers do the work.
Yeah, mothers do the work.
Hey, mothers.
And from there, then my mind started to really thinking about it. Then I said, okay. Then I asked her again, what did the mothers do? And she said, mothers, they give the food. And I said, okay. In here, mothers give the food.
Same thing, yeah.
Yeah.
Give the sweets.
So that's the problem.
That's a problem.
And point number 2, she said that mothers always brush the children's teeth. No, and that's a activity, and it brings bond to the mother and the child. And the mother and the child too will know, oh, my mom cares for my teeth. My mom cares for my health, my overall health.
And then takes them to the dentist, not just for the visit.
And all those things. And then point number 3, she said that in Korea, the mothers, they always have this instinct of opening their children's mouth. And then I was thinking, oh, here, the only time you open the children's mouth when the child cries. During eating time or sleeping time, and the child cries out, they said, open the mouth. Then we see all the disease of the mouth, the tooth problem or dirty teeth or what, all there.
Tooth
decay and unclean teeth. And then we're going to pull out the
there's
teeth.
a big cavity here.
Yeah, we're going to pull out the teeth. We're going to pull. And you see, we're going to pull, big problem there, struggle. And then after that, as I've said, the problem does not end there. Because with the absence of that unique tooth, the food is not properly digested.
Because digestion begins here.
Begins there. And remember, all teeth is different. No two teeth is the same. So when you lost a tooth, you're losing 100% of use of the tooth.
Okay, so mothers, please remember, open your child's mouth every day. And make sure you brush the teeth.
So
and give the right food
at the right time.
Sweets, not the sweets or whatever they cry for.
True.
And nowadays you open a child's mouth, all the colors,
and like we take it for granted. Oh, that's normal.
No,
and then after that, then pull out, and that's no. Children's teeth should just fall out. Okay. God will be that's God's prerogative, and that's His problem.
It has to fall in order for the right one to grow.
And I remember again that when I went to Japan, and I went to one dental office, and then I saw the children sitting down, and these toddlers, like 3, 4, 5 years old, and then I asked the dentists, where are the parents? And they said, oh, and here only during the first visit, the parents enter into the main clinic. At the second and third visit, the parents, they are somewhere else around the building. They're waiting there, or they go do the shopping. And then she told me something. In here, the children, they enter smiling, they leave smiling.
About Fiji.
And that's a story that we have. That's why we are here, to help Fijians to have something in the...
They enter already crying and then
go back crying, minus the tooth, and then their eating is compromised, the smiling is compromised. and that memory lingers in the mind. That's why it's very important that in early life we have to instill happy memories and a happy life.
Like how you react to things.
Yes.
If you are happy, that state of mind will stay like that right throughout the day.
Okay,
so those are common health factors there. So let's move into our TMJ disorders because they will be connected with what is in the
and
chart.
Again, again, when someone has got chronic stress, and then he or she goes and eat anything, drink anything. And then did not brush the teeth, and because he's undergoing stress, he's not managing, and then the problem of the gums, and then in the heart problems, because they're all connected, because he's trying to solve the stress problems through all the wrong ways.
Using the wrong way to solve the problems. Okay, so in our last episode, we started looking at the negative attitude or the TMJ disorders.
Yes.
And we saw the stress and muscle tension, which leads to negative attitude, which causes stress level. And to prove that you're stressed, you will be grinding your teeth.
That's the physical manifestation.
Teeth grinding. Bruxism. Bruxism?
Yeah.
Stress often causes people to grind their teeth, especially during sleep, leading to TMJ disorder.
And remember, if someone grind the teeth or gnashing the teeth, it will be very painful. And then the sound of it, which will be very irritating to the ear. And remember, and the muscles will be not. And remember, that's during sleeping.
Okay.
The time we should be resting.
True.
The time our body should be, recuperating and mending, rebuilding. But then someone is slipping away with all this thinking in the mind, might be undergoing stress and all this grinding of the teeth, and they have this negative manifestation in the whole body.
Okay, our second one is a lack of trust and fear. Lack of trust and fear. Okay, so a negative view of God's character can lead to fear and anxiety. All right. So how is this manifested?
A negative fear, a negative view.
Negative view of God's character.
I remember that to fear God is the beginning of
wisdom.
Yeah, and the fool say in his heart,
"There's no God."
Yeah. So we can see.
It's interesting. Okay.
It's very interesting. And a negative view of God's character can lead to fear and anxiety. But Jesus is saying, cast your care upon me, and I will give you rest. And again in John 14, it says, the peace I give to you, the world cannot give. So we can see it also lead to clenching. As we see, you clench your fist. This is a sign of anger. And you
clench.
They just sort of
clench your, like that. Clench your teeth.
Your teeth, right. Clenching, anxiety often results in clenching of the jaw, which puts excessive pressure on the TMJ. See, our TMJ handles pressure. It can, but then we have to maintain. We have to be friendly to your TMJ. You have to help in how our TMJ function, because it can only handle, because excessive pressure can lead again onto the.
Sometimes when mothers are angry, they clench their
and then it leads to everything wrong.
And they are providing unnecessary stress on the TMJ.
And remember, when we try and take things into our own hands, then that could be a sign of lack of trust and fear.
When you don't trust your God, you don't trust your spouse,
you want to
you don't trust your daughters, your children. Sometimes they on TV they say, parents, do you know where your children are? Where is your child?
True.
Those type of tension are created, and then it provides unnecessary stress.
Yes.
Okay, so we're looking at
inflammation, and the inflammation.
This inflammation here, constant tension and lack of relaxation can lead to the inflammation of the TMJ.
Causing pain and limited movement.
So inflammation, that's when something is inflamed. It's reddish.
Yeah,
it's like there's a boil.
Right. The color, the feeling of it, and it becomes like away from the normal. And if it's constant tension, see that word, constant tension, and the lack of relaxation. See,
sometimes your jaw is painful and it's not relaxed. Like you struggle to chew.
Yeah.
You can't really open your mouth wider. And that is, it can start up. It can begin from lack of trust and fear.
Yes.
When you are afraid. Like you go up and you're going to speak from the front and you have that fear.
Oh, yes.
You start sweating, your mouth just dries up.
That's a very good physical manifestation, dry mouth.
Dry mouth,
And some say the butterfly in the stomach. Yeah. And we can see here. And then, this dry mouth, this is a big problem. And people tend to just see for dry mouth, and they tend to alleviate that dryness of the mouth by drinking sweet drinks. And they don't know that sugar in the sweet drinks, they even increase the dryness because they become dehydrating agents. So you continue, just like for water, you just drink a cup of water, but that's enough.
That's the job.
Just the job.
So remember, it's water that you need to drink, not all those sweetened drinks that you have that are sold in a lot of these
sugary
outlets.
They tend to promote these inflammations.
Our third TMJ disorder is isolation and emotional pain. Isolation, isolating. You are there by yourself. Many times, I remember even me, I did it to my kids when they were growing up, especially my son when he's he's a bit naughty. Isolate him. Go to your room.
Isolation.
So this isolation. But let's see. Feeling distant from God can result in emotional pain and isolation.
Oh, yes. That's being isolated and emotional pain.
Just imagine you're isolated from God, like,
Then it's a very...
You're no longer... Once you isolate yourself from God, you are also far away from people around you.
Yeah.
Like, you rather be by yourself, and you're not even opening God's word to read. Like, you isolate yourself.
And can anyone isolate himself from God?
It does happen.
But they think they're being isolated from... But
God is there the whole time.
The whole time, 24/7.
Yeah. Okay.
And but we can't... but then to distance ourselves from God, as we have said, only the fools do that.
And the interesting thing here is feeling distant from God can result in emotional pain and isolation.
Yeah.
And it can cause poor posture.
Yeah, we see people who feel isolated and like, you see their posture, they're looking down and they're like touching their...
And then, they start...
no vibrancy, no happiness, no joy.
Like when you're happy, you're excited, you're walking and
you're
not dragging your feet, you're not, looking half dead.
No.
Okay, so poor posture, emotional distress can affect overall posture, which in turn affects the alignment and function of the TMJ. The alignment and the function of the TMJ. Okay, so that's poor posture. It's amazing. Eh?
It's amazing
how all these things just go and affect.
Yes, because they all work together.
How about that reduced healing you have there?
Yes, reduced healing for emotional well-being is crucial for physical healing. Negative attitude can hinder the body's ability to heal TMJ disorders effectively.
So let's just not have a negative attitude.
No.
Let's be happy.
Be happy.
Let's be positive.
Be full of praises. Yeah.
So we need to talk nicely to each other.
Yes.
Get up in the morning, parents, talk nicely to your kids.
Yeah.
And children, once you start yelling at the kids, hurry up, come on, where did you leave your uniform? It's not even washed. Those kind of things. You start yelling at each other. TMJ is going to be stressed.
We think we are yelling and like that we are showing power and we are, but we don't know that we are creating havoc on our own health.
Creating a lot of havoc. A lot of, just those negative attitudes will result in TMJ
destroying our own
disorder.
Disorders,
Okay, now some holistic approach to TMJ health. We have a few there. There's 2 there. To maintain TMJ health, it's important to address both physical and emotional aspects. Okay, some strategies are there. Physical care.
Physical care. Oh, you've got a very good jaw exercise, which was advised to you back in Papua New Guinea. That's very good.
You simply go like this.
How can you just show it?
Because your lower jaw is the one that
moves,
not the upper one. No. So you just put this one here and you move your jaw down. And you can
I see all the things here moving. Right.
Sometimes we eat corn. Some people eat a lot of corn. Here, the maize. We eat a lot of the maize.
Maize,
not the sweet corn. In some parts of like
corn.
In Papua New Guinea, they eat sweet corn rather than this maize.
Okay.
And this one here for the horse, the one that we eat here in Fiji. But it's quite hard, and they sell the hard ones here. So those ones can cause stress on you. So when it's stressed, make sure you do that exercise.
Thank you. That's a very good.
Do that exercise and
jaw exercises. Regular exercises can strengthen the jaw muscles and improve flexibility. And we see one of the way to for regular exercising to chew sugarcane.
Those of you that have good teeth, some of us. The sugarcane come out, the teeth also come out.
So it's very important that we make sure our muscles is exercised, our teeth and our jaws. And when we're doing that, we are giving exercise to the TMJ. And TMJ can handle pressure. So we have to, because if we eat soft foods all the time, then we're not giving
the proper exercise.
Talking
about proper posture. We need to sit straight.
Sit straight
have a
and
good posture,
be very
rather than crouching like this.
Don't stoop.
Stooping.
And because everything is in balance.
Okay.
Proper posture, maintaining good posture helps align the TMJ properly.
So your good posture will align your whole body.
Right.
And the TMJ in particular.
Oh, when it comes physical care, and then I was thinking about when we eat it, when we chew food, we must make sure we don't just chew on one side. Try and then maintain the balance.
That reminds me because I said I went to my dentist last week, and he asked me the question he asked me. So, which side of the mouth do you chew on when you're eating? I said, this one. So that tooth there is stressed. You overworked it. That's why,
Yes.
So what you just said, we need to balance that. Not just punish one side. Not really punishing, but not just put
overworked to one side.
It gets overworked.
But that's one thing too. Then that's why it's important to have all the teeth. Because if there's no teeth then this side, then this one definitely will have all the and then there'll be
making me feel very guilty. Okay. Emotional and spiritual care. Stress management. Tell us about it.
Techniques such as meditation, prayer. And we are undergoing 10 days of prayer.
True, right.
And I'm very happy. Every evening I go for prayer. Oh, and then we are singing, then we are praising because they are part of our emotional and spiritual care.
When they do training, voice training, and mouth, how to articulate it.
Right, articulation.
I had a lecturer. I used to have a lecturer at Fulton. He's a very good singer. And Dr. Berry Hill. And, he would do the voice training and all that in the mouth.
Wow.
Open the mouth and, really open it wide.
Right.
Even the choir, when they sing, the Methodist choir, you see them when they sing.
Yes.
Their mouth is
lovely.
And the
sound comes out.
So here, see, stress management techniques such as,
meditation,
deep breathing,
prayer and deep breathing can reduce stress.
Okay, deep breathing is important.
It's very important.
There's an exercise. I got very sick when I was in Papua New Guinea.
Okay.
I was told by my doctor that I needed to do breathing exercise.
Wow.
So this is
and you thinking, I'm breathing, but now deep breathing.
I'm already breathing, but deep breathing is important. So you breathe in, you breathe in and you count to 20. Right? Yeah, 20. To count all your fingers and all your toes.
Oh.
And then breathe out, count to 10.
Oh, 20,
That's
10.
deep breathing.
Mm.
And you can feel the air going right
Into your lungs.
and your stomach now bulges. And then you breathe out, and it comes out. And breathing out, you count to 10.
Oh.
And then in again.
In again, 20.
And you do it 20 times in 1 minute. 20
Oy.
times. That breathing in and out in 1 minute, you do it 20 times.
Within 60 seconds.
Yes. And you do that.
Yeah.
In, count to 10, and then breathe out. And while you're walking, you can do that. So that's this breathing.
Because our
Deep
body is
breathing.
wonderfully
That's
done.
deep breathing. Yeah.
Okay.
Okay, your positive attitude?
Cultivating a positive view of God's character can foster trust and reduce anxiety.
True.
See, if you don't if you have a negative attitude towards God's character, then your anxiety increases. But when you have a positive attitude, anxiety decreases. Okay. So our body, because He's a maker, and then
thank you.
And we should rely on Him.
True.
Some people, when they feel anxiety and stress, and they say, "Oh, let's go happy hour." Again, another problem.
Stress level goes up. Okay, community support. That's where they should go. Rather than going to the happy hour somewhere else, you go for community support.
Engaging with a supportive community can alleviate feelings of isolation and emotional pain. That's very true.
Rather than isolate, some people, they get angry and all that, they go and isolate themselves.
Well, more problem.
Why not
go and help someone?
Help the community.
Go and say, let's do a smiling session.
Okay, conclusion. The health of the TMJ is interconnected with emotional and spiritual well-being.
Yes.
A negative attitude toward the character of God can lead to stress, anxiety, and physical manifestations such as TMJ disorders that we just looked at.
Right.
By addressing both the physical functions of the TMJ and fostering a positive, trusting relationship with God, individuals can promote overall health and prevent disorders.
That's that's an antidote.
Yeah.
That's the medicine for us Fijians.
You address both your physical functions and of the TMJ and fostering a positive, trusting relationship with God. Individuals can promote overall health and prevent disorders.
Overall health and prevent disorders and prevention. Prevention is better than cure.
Yes.
And then now we're having this promotion of overall health, as our topic used to say, oral health and overall health. And then I remember this acronym about the New Start, the nutrition, exercise, water, the temperance.
New Start, sunshine.
Air, S, the sunshine, and then the air, rest, and then the T, the trusting God. So in here it says, trusting relationship with God. Individuals, each Fijians can promote overall health and prevent disorders.
Yeah, thank you. Those are an holistic approach to your TMJ health.
Oral health and overall health.
Thank you for being with us. Time has caught up with us again. Let's say goodbye for now, and we'll see you in our next episode.
Stay well.